that's okay. If anyone opposes that, just let me know. But I started. Thank you. Okay.
Yeah, I would like to quickly start by giving a brief introduction of ASH and what we do. Action on Smoking and Health was funded in 1979 and is one of Canada's leading tobacco control organizations. Over the years, ASH has provided local, provincial, national, and global leadership on tobacco control. Our strategies include public awareness, education, community mobilization, applied research, and public policy development. This project represents a collaboration of This project represents a collaboration of ASH, the Canadian Cancer Society, Heart and Stroke, the Lung Association, and all 4 provincial tobacco reduction coalitions in Western Canada. Health Canada has provided funding for the project through the Substance Use and Addictions Program. All of these organizations have contributed staff time and in-kind support to this project, and we are delighted to work together on this important issue of youth vaping and renormalization of public smoking. This project was developed to help prevent the renormalization of smoking that may result from cannabis legalization. However, we are also very concerned about the explosive rise in recreational vaping and its potential to renormalize public smoking. This is the brief history of our project. This project was started as a provincial pilot in Alberta that ran from 2016 to 2019 that was funded by Alberta Health Services. The pilot project contributed to the development of 50 gold standard bylaws and policies in municipalities, school districts, and post-secondary institutions throughout Alberta. Based on the success of the Alberta pilot, we worked with our Western partners to secure Health Canada funding to scale up the project to include all Western provinces. We launched the new 3-year project in July 2019. We spent the first 6 months conducting baseline surveys of municipalities and education in the 4 provinces, and we produced a new online policy hub that includes all the bylaws and policies that we collected. ASH also hired policy specialists in each province, in each Western capital, and began outreach activities in January 2020. As you probably know, images of youth vape tricks and clouding are being widely distributed to kids through social media platforms. The vaping and tobacco companies have sponsored clouding events and competitions and have paid youth to promote these images through social media. While some may argue that vaping is not smoking, the emissions look like smoke and the actions look like smoking. And the widespread distribution of these images has the potential to renormalize smoking. Modeling is an essential element of childhood development, and it's a very effective learning mechanism. If we model healthy behaviors to kids, we are more likely to get healthy kids and vice versa. We know that parental modeling can influence youth smoking behavior, but we should also be concerned about social modeling, which can be just as influential. For example, the depiction of smoking in youth-rated Hollywood films is reported to be responsible for up to 20% of youth initiation. If virtual modeling can have such a profound impact on youth, we should be very concerned about reality modeling, such as smoking and vaping in public spaces. I would like to run you through quickly through our project goals. Our mandate is to support, my laptop. Our mandate is to support the development of tobacco control bylaws and policies for municipalities, school boards, and post-secondary campuses. Monitor and measure bylaw policy development, monitor and measure knowledge, attitudes, and beliefs regarding the renormalization of public smoking in the 4 Western provinces, build awareness and improve education by offering access to information, resources, and toolkits. Our project activities include creating inventory of tobacco smoking bylaws and policies among municipalities, school boards, and post-secondary campuses, creating and disseminating model bylaws and policies to relevant policymakers, provide consultation and training to policymakers, prepare briefs and make presentations to policymakers, engage with local public health stakeholders in targeted communities, and create and disseminate resource materials. Policy solutions. So here are the policy solutions that we are pursuing. Aligning restrictions on the smoking and vaping of anything. Cannabis restrictions are often stronger. Vaping and smoking restrictions should be aligned. Regulate the behavior, not the substance. Behavior is much easier to enforce, and it reduces social modeling. Build public awareness and support. Publicity derives the public agenda, and we all know social media can mobilize support. Our progress till date. We have made substantial progress to date, even under the constraints of COVID-19. We have conducted baseline surveys and created bylaw policy inventory, developed new model policies, launched new online policy hub of bylaws and policies in Western provinces, which can be accessed on our website, ashpolicyhub.ca, created new policymaker database, engaging with hundreds of stakeholders and policymakers and stakeholders, over 4.4 million people protected by improved smoke-free legislation in Western Canada so far. Our policy hub lists all the applicable policies and resources available in each province. It also lists all the policies and resources by setting, including municipalities, school districts, and post-secondary institutions. The Policy Hub includes a progress dashboard that allows us to actively track policy development and to compare the progress between provinces, municipalities, school districts, and post-secondary institutions. As you can see on the screen, the dashboard also allows us to track the major elements of the bylaw or policy and the population cover. We are actively collecting and adding new bylaws and policies to the hub. Please feel free to visit ash.ca to check out the hub. Of course, these bylaws and policies aren't created in vacuum, and this project is very focused on outreach and policy development. This is a quick review of our next steps, which is to continue with virtual or digital outreach efforts, keep smoking and vaping on the agenda, engage with partners and public health officials, promote new policy hub and resources, focus on major cities, districts, and institutions, reach out to First Nations and Métis communities, and of course, seize all opportunities. This is in terms of Lethbridge, the local opportunities that we have identified and we would like to explore and discuss with you. The first is updating the Lethbridge smoking bylaw to expand outdoor smoking restrictions, including all parks and public events. ASH is asking municipalities to make all public recreation and gathering spaces completely smoke-free. Lethbridge was once a leader on smoking control, and it was the first Alberta municipality to ban smoking in restaurants. Second, creating smoke-free campus policies to support the long-term health and well-being of our community. Smoking or use of tobacco or vaping products should be uniformly banned in all campus buildings and facilities, on campus grounds and properties, in all owned or leased vehicles, in student residence, and at campus events. Many children and youth visit facilities and events on campus, and they should not be exposed to tobacco use in these settings. Third, providing support to school boards and school administrations to adopt policies for smoking and vaping preventions and cessation. Schools are the epicenter of youth vaping epidemic, and school boards are looking to help to address this problem. As I said before, modeling is an essential element of childhood development. If we model healthy behaviors to kids, we are more likely to create healthy children and vice versa. Municipalities, school boards, and secondary institutions play a key role in reducing the social modeling of smoking and vaping. We would now like to discuss these opportunities with you to see if we can work together to create more smoke-free spaces in Lethbridge. Please feel free to connect with any of our policy specialists. If you would like to discuss further policy opportunities, these are the contact details province-wide. For Alberta, it's me, Disha Panchal. For BC, we have Marilyn Bergstra. For Saskatchewan and Manitoba, we have Adam Anderson. We have a great team, and they all have lots of expertise and enthusiasm. We are very willing to work with anyone who is pursuing a smoke-free bylaw or policy. Smoking rates are at an all-time low in Canada, and public smoking restrictions are an important part of our overall success. We simply cannot allow smoking to be renormalized. I would like to thank Health Canada for its generous support on this important project. Thank you once again all for joining us today.
Thank you, Disha. I'll stop the recording.